All right, keeping an eye on your health this morning for our Nurses Know segment, we are talking about what's called RSV. And again, this is a very highly contagious, can be dangerous for babies. So joining us with more information from Children's Hospital now is registered nurse Vanessa Della Gallia Lake to talk about what RSV is. First, parents are probably wondering, what is this? What are the common symptoms?
Yes, RSV is a very contagious virus. It causes infection to the lungs and also breathing passages, and this can lead to difficulty breathing, especially in babies.
Scary, yeah.
Very scary, especially in the small babies.
And what are the common symptoms that you see with this parents need to look for?
Well, you can see struggling breathing, you can see fever, coughing and sneezing for sure, nasal discharge, and also dehydration when they start refusing to eat or drink.
Yeah, and you think of babies, you worry so much about them. When do parents need to say, hey, we need to take this little baby to the ER?
Definitely if they starting to show symptoms that they are not able to get some air in, if they are breathing, struggling to breathe, if their fevers get really high too, and if they are not eating or drinking, they are probably dehydrated. So if they start showing some signs of this, please take them to the ER.
Yeah, and adults are not exempt from this either.
Yes, but in adults, this is more like a regular cold.
Okay.
This issue is more for babies and young children, like more younger than 2 years old or something like that.
And pretty common.
Oh, it's absolutely common. It's we get them every day at the hospital between November and April, basically.
All
Those
right,
are
and
the
parents are
times.
probably wondering too, how can I prevent my child from getting this or getting sick?
Well, nurses are never going to stop saying that we need to wash our hands frequently. It is true. That's the best way to prevent these transmitted illnesses. This RSV is transmitted through droplets that contain this virus. So when someone sneezes or coughs and they don't cover their mouth, then the droplets go everywhere. So please make sure you disinfect surface areas and make sure that washing your hands and your kids' hands are very important.
Very important for this, and I'm sure other illnesses as well. Thank you for your time. We appreciate it. And we'll have all this information up on our Nurses Know segment on local8now.com. And now we're going to check in on what's coming up our next half hour.